I know all this information may seem very, very overwhelming, but please know that you can ask as many questions as you need to feel comfortable with your port to either your nurse or your healthcare provider, and we'll make sure that you and your child feel comfortable before you go home.
What was the line placement like?
So she had to have surgery under general anesthesia to have the portacath placed, and that was a pretty short procedure, about an hour. And after the procedure, she just went home and didn't have to stay in the hospital. And the portacath site where it was inserted was sore, but even the nurses at the Jimmy Fund, they're such experts at accessing the portacath that they even know how to access it when it's still sore, when it's just been implanted. And it takes a couple of weeks for that soreness to completely go away, and then it's, they don't feel it at all. Like Erica didn't feel her being accessed at all. And they can leave the needle in even after the procedure if that's what, is required by the hospital. Okay, so after the portacath is placed, there's an incision of about 1 inch long where they place it. And there's steri strips over that site, and you just ignore it basically. You don't have to clean it or do anything to it. You just leave it alone, and the steri strips just dry up and fall off on their own. And then you're left with a small scar in your skin, which the scar from the first time she had a bone marrow transplant was 5 years ago. That's completely white. It's just a little tiny scar that you can't even notice. But the one that they're using now with her treatment now is a little more red because they're continuously accessing it. But once the portacath is removed and there's no more accessing, the skin just really recovers nicely. It really is such a straightforward thing, and it doesn't seem like I even hear parents talking about the portacath. It just seems like something you automatically get, and it becomes part of your life, and it becomes part of the overall experience, and it's absolutely makes it easier. I think when I talk to parents, it's more about the side effects of the chemotherapy and how that affected their child, more than the portacath. The portacath just becomes something that's automatic.
What's it like using the line?
Well, the portacath is really easy because you don't have to flush it every day like you do with the PICC line and the double lumen line. And the portacath is also easy because it takes out the anxiety of getting blood work done in the first place. So I know when my daughter comes into the Jimmy Fund to get her blood work and get her checkup that she's not worried about it, and it should be easy for her and painless, and it's much, much better than getting an IV, which is painful, and sometimes they miss, and it's multiple sticks, or you get a blown vein, and then her arm is sore. With the portacath, it's very straightforward and easy, painless.
How is the line accessed?
The one way that you can help access the port is by putting a specialized cream on it called ELMA or LMX cream. And this is a numbing cream that goes over the port an hour or 30 minutes before the port's going to be accessed. And that helps alleviate some of the discomfort of the needle going into the port. And then we use a specialized needle called a Huber needle. It looks like this, and we use this to access the port. And you won't have to do this at home. This is done by a specialized nurse or a visiting nurse, and they'll come and access the port with this specialized needle. And when it's accessed more and more, you'll learn how the special tricks to help the nurse or the visiting nurse access your port.
I get my port accessed once a week. It might seem like a little scary because it's a needle going through your chest. And I don't blame people for being scary. I would be scary too. But what happens when you access a port is you put like this special numbing cream. People usually call it EMLA on your chest here, and then it makes your chest numb, and then you actually don't feel the needle going through. And when they put the needle in, it goes in the port. It doesn't go actually in you, so it actually doesn't hurt at all for me. Some kids like yell and stuff, but I think that's because they're scared or something.
Yeah, so EMLA's on before we leave the house, and we have a good hour-and-a-half drive into the clinic, so Erica's very numb. The site is very numb before they access her. And then, the visiting nurse will call about an hour before she's going to arrive at the house and say that she's on her way, so then we put the EMLA cream on then, too. So they say it only takes 20 to 30 minutes to work, but we always have it on for a good hour, and she seems to be incredibly numb, so she can't feel a thing at all, so it's really painless. The STEMIFA nurses typically don't have any problems finding the port because they're such experts and they do it all the time. But occasionally we have to go to the emergency room if she got a fever at night or over the weekend, and they do have a hard time. So we say to the emergency room nurses, would you mind getting a 6 North nurse? And the 6 North nurses, who are also really used to accessing ports, one of them comes down and just does it. And that makes it a lot easier. So that we just remember to make sure that they call a 6 North nurse. But yeah, the nurse definitely does the accessing. But now that she's switching to a different regimen, they are going to teach me how to de-access, which is just pulling the needle out. So they are going to teach me how to do that, which I feel comfortable doing that. I'm not sure I feel comfortable with actually accessing it. So leave that to the professionals.
Do you access the port at home?
I have a couple times. That's just basically like accessing in the clinic. It's just that they put the special numbing cream on before your visiting nurse comes, and then they access the port. It's basically the same thing.
Yeah, we access the port mostly at the clinic, but sometimes the visiting nurse comes out to the house and accesses her at home. And she just does it right in the living room, so it's really convenient for that too.
What about bathing, showering, and swimming?
24 hours after the portacath is placed, a child can shower or have a sponge bath. And then in about 2 weeks after the line's placed, when the steri strips fall off, then the child can swim or bathe.
Okay. Well, that's the really wonderful thing about the portacath is you can swim and you can take showers and you can play sports and you can do whatever you want. With the double lumen line, there's always a risk it could fall out or get yanked out or get pulled on. Same thing with the PICC line. The portacath being under the skin and being relatively small, you can really have total freedom of movement and you don't have to worry about getting wet.
Can you feel the port?
Well, it depends on how you feel it. If you're like just sitting like around or like even running, like I can't feel it at all. Some kids may be able to feel it. Like I had a friend once who had a port also, and her port was very like near the surface, and she said when she was running or exercising, she said she could feel like the port a little, but my port's very deep, so in my chest, so I can't really feel it at all. But if you take your fingers and you sort of rub over area where your port is, you can actually feel it. To me, it feels like you have like a grape underneath like your chest, and you can feel like this grape underneath there.
Is it weird to have a port?
To be honest with the port, you don't really feel it at all. It's just, you can sleep on it, sleep with, like, on your stomach with it. To be honest, it's just like your usual self. It's just like a little thing that it's in your chest that is very helpful, I think.
Who do I call if I'm having problems?
The best people to talk to if you're having questions or problems with the line is your child's healthcare provider. Also, your visiting nurse may be able to answer questions when they come out to access the port. If you're in the hospital, then you can certainly talk to your physician or your healthcare provider or nurse about the portacath. One thing to keep in mind is that if your child has any signs of infection, such as redness or swelling over the port, any pain in the area of the port, also, if they have a fever above 100 degrees Fahrenheit, then you'd want to have them evaluated, either at the emergency room or to call your physician.
Yeah, if you get a fever, that's the number one thing they tell you to watch for. So if you have a fever, or even if you feel sort of lethargic or not yourself, so I watch for those signs. And if those happen, then I just call right away. And they access the port and see if she does have a blood infection. They just test for a blood infection, and if something grows out after 48 hours, then they know she has it, but they start the antibiotics right away, just in case there is something there, and they stop them if nothing, grows.
What about infection?
Unfortunately, portacaths can get infected, and it's nothing that you did as a parent or your child did to cause the infection in the portacath. And as a healthcare provider, when we access the port, we use sterile technique. One thing that you can do as a parent is to make sure the healthcare provider who's accessing your child's port washes their hands before they access the port and also before any time they attach a line or manipulate the child's port when it's accessed. If the port becomes red, if it becomes swollen, painful, if the child has a fever above 100 degrees Fahrenheit, it's a possibility that the line has become infected. We can and the child should be evaluated by a physician or through the emergency room.
Actually, after her bone marrow transplant, she had a staph infection of the portacath, and it was treated with intravenous vancomycin in the hospital and for about 3 days, and then we went home and gave her the intravenous vancomycin at home. And it cleared up, and it was, just resolved itself, and then the portacath could just keep functioning after that. And sometimes the portacaths do get clogged, so sometimes if there's like a blood clot at the end of the catheter and they can't get good blood return, but that happens very rarely, and when it does, they have like an instant fix for it that takes about an hour. They put something called TPN in it, I think, or TPA, and it just goes through the line and clears it right up, so that's pretty much a non-issue too.
How do I keep the line private?
You can see your incisions if you take your shirt off or something. It basically looks like a big cut or something. But mostly you don't see that if it's covered up by your shirt. And you might get when you first get your port, it might be like a little red or something. So just important not to touch it or whatever. Unless you told somebody, nobody would really know about your port. I don't think.
What about teens?
Teenagers can manage their own lines themselves. They can look to make sure there's no swelling, infection, any pain, as long as you feel confident that your child will tell you if they have any problems with their portacaths. They can also keep it hidden. They don't need to tell their friends about it. Just to remember, though, that teenagers and children cannot play contact sports with the portacath.